Here is another video in my journal of the brain surgery for Meniere's disease called vestibular nerve section. I am updating you kind of on a day-to-day basis. Everybody's different and everybody heals differently. It's like I try not to let myself get too hopeful that I'm making significant improvements because I haven't been. It's been really hellish. It has been a very, very hard recovery. But I started vestibular therapy. Today is Wednesday. I started it last Thursday with the evaluation and they gave me exercises to do at home. I think that they have really been helping and I have been noticing changes, which I hadn't been before. It's still hard for me to be in with people. When I get into around people, my body just starts to shut down. Like I'm so hypersensitive with sounds, but like just physically, just all the things, the visual stimulation, and I get a lot worse. My vertigo gets worse, my balance gets worse. And so I had therapy yesterday, physical therapy, vestibular therapy, and I waited in the waiting area probably about 15 minutes and was so overstimulating. By the time I got to the quiet room that we usually work in, we had to sit there for 10 minutes for my body to recover. So tomorrow when I go in, they're gonna take me into a quiet room immediately while I'm waiting for my appointment to start. That's a good accommodation for where I am right now. I live in a quiet house with dogs that are quiet for the most part, except for when Dash decides to go on a barking spree. This is a vestibular therapy exercise. Basically, we're trying to retrain the ocular nerve reflex with these exercises, trying to get the brain to recognize when I'm turning my head, which is really hard because it's not getting input from my right ear anymore. So it's not getting the signals that my ear would give my brain saying that I'm turning a certain way. So it's trying to use the signal from my other ear, which is complicated. So I'll show you these. These are with pens, but they're basically eye movement. They're so hard. I can't even say how hard they are. And then this is, I hold the paper still and I move my head either left to right or up and down. Again, very hard. And then physical therapy ones, hip abductors, trying to squeeze a ball between my legs, marching in place, in addition to all of the ones that I do on the bed. And then these are for arm strengths using a resistance band, which on this side, it really hurts my muscles. I have a lot of muscles that were cut to get into my skull, my brain. So those are like actually one of the biggest pain. Like that's the biggest pain right now. My incision still hurts, but it's that muscles are, they also had me standing up at a counter to see how long I could stand. And at home, because it's so quiet, especially when I'm doing really good, there are times where my vestibular system gets, it's like I feel like I'm like taking 2 steps forward, 1 step back. And it's kind of different like throughout the day. I don't know if it maybe medication or environment or something is changing and then somehow I'm worse. But I've learned that after waking up in the morning, I can't just get up out of bed to feed the dogs. I have to kind of gradually sit up and let my vestibular system kind of recalibrate after laying in bed asleep for so long. So it's just different adjustments I've been learning. I'm doing so much better with these, but they are hard. They're torture. Like I told my physical therapist, I said, do people call you torturers? Like it didn't mean it for real, but they're actually heroes. I mean, they're helping me to get my life back. And I feel like I've already changed so much in less than a week. There's 2 pens, and vestibular therapy for me right now is looking back and forth at the top of the head of the pen as fast as I can while keeping it in focus and not blinking, because blinking is kind of a compensation for the vertigo. So I have music running when I'm doing it, and I put on a timer because I'm supposed to do it for 20 seconds. Google, set a timer for 20 seconds, please.
All right, 20 seconds. Starting now.
And I have to go as fast as I can, which has gotten so much faster. When I was evaluated, I was going slow and I was blinking between every look. And now my goal is to not blink and go fast. Stop. Google set a timer for 20 seconds.
Okay, 20 seconds. Starting now.
That's so much easier. But both are hard. And then usually I will use my paper and I'll focus on the word hold when I do looking back and forth. So I'll show you what that looks like.
Sure, 20 seconds. Starting now.
I have to go as quickly as I can, but not too quickly that I can't focus and maintain the, not going into a vertigo type of thing. Stop. Then the last one is up and down.
Starting now.
Ugh. I'm recovering a lot faster than I did in the beginning because I would just like, blah. I think that this is going to progress to doing these standing. Whoa, since I got pretty turned around right there, I'm going to sit and give my body a chance to rest and readjust with that. I feel hopeful and excited that I am making improvements. I don't want to cry. I've been worrying through this thing. I've been fighting so hard, and I am just so determined to get stronger and to get physically healthier. And like, I want to continue not just to like a typical level of strength physically. I want to be working out and I want to be, doing things I couldn't do. It's like going to go from Hell's Gate to Heaven's Gate. Like, it truly is going to be this, I'm navigating the valleys and the trenches of this really rocky mountain range right now. And sometimes because of that, the sun's hard to see and it's cloudy, or I'm in the darkness a lot. I haven't gotten depressed because I have the hope that things are going to get better. And I have had so much support. It has been incredible to have people continue to care and remember me 4.5 weeks later. There's so much to say, there's so much to recount, and it was very hard to talk about it while it was happening because it was so real and so raw and so horrible. And it's still real and raw and horrible. It just seems like I'm making some improvement, and that's giving me hope. I've learned so many tools in being chronically ill, and I think that they have all served me well in this journey. I'm just excited to be in a place to be sitting here and talking. It is causing me vertigo, but I think that every single thing that I do, that, I've moved so gradually. Like, I've pushed myself, like my mom has commented every single thing that I've done. Like, I've been self-motivated to push myself to the next step. I've let myself rest, but I've also gone when I could take a responsibility away from her, I did. I'm just so grateful for all the support I have. I truly could not have done this without support. Like, people say that, but like, really, truly, I couldn't have done it without my parents, without my mom and dad, without Shanna, knowing people are truly rooting for me. There was one time when my medication was making me feel very hopeless and like maybe I shouldn't be here anymore, and that was a medication related thing. But even then, I knew that I had people caring for me, and that meant so much to me. It made life worth it, even when I was in that really hopeless place. And it's why letting each other know that we're not alone is so important. Reminding those that you care about, reminding strangers that we're not alone. because that is powerful. It's so much more powerful. I think that's why depression and suicidal thoughts are so insidious, because people go into themselves and don't reach out to people for a variety of reasons, and then they don't get the rush of being around people and being connected to people, because it does, like, no, it doesn't change the situation. It doesn't change how horrible things are. You know that, like, you can do this and you want to do this because you have these people in your life and your life matters. You're not alone. I am Kelly. Remember, you are not alone. Live incredible anyway. Bye, guys.
You are not alone in this world. You are not alone. You are not alone in this world. You